I had my NP degree, but I was working bedside nursing in Colorado as a critical care nurse. And my patients were having these large surgeries, and we were only using opioids to manage their pain. And I just got really passionate about why don't these patients have epidurals? Why are we only using opioids for their pain? So the hospital in Colorado was just like, well, you seem to know a lot about this. Why don't you start a pain service? So I said, I'm a smart girl. I can figure this out. So we started a pain service with the anesthesiologist and a pharmacist. And that's how we started first. And we made some protocols, and we started to get the patients better pain management. If you think you're going to make like a big difference in an institution, I don't know if that's true or not, but you do make a big difference to the patient that's in front of you. So I had a patient who broke her ribs, and she was probably an hour or two away from being intubated and going to the ICU. And they called us because she couldn't get any pain management. So they called us, and we placed an epidural in, and she never had to go to the ICU. And she was able to recover without being intubated, getting pneumonia, or any of those sequelae that you usually get when you break your ribs. I think that we're perfectly positioned to do this job because we have more time than physicians usually. We don't cost as much as physicians generally, and we spend more time we're able to spend more time with the patients. And I just think it's a perfect world between pain management, medicine, psychology. Those are all things that you have to address when you see a patient. It's not just their pain, it's what the pain means to them. And I think it's really rewarding as an APP to be able to have time to work that out with the patient. I introduce myself, I tell them I'm with pain management, and then I just ask them how things are going. And then I let them tell me their story. And then we go from there with a pain management, we go forward with a pain management plan. Sometimes it's more complicated if they've had chronic pain in the past and now also have a surgery pain or acute pain. Sometimes it's just very simple and straightforward with just, acute pain, surgical pain that's going to get better every single day.